We are here with Dr. Bilski. You are a doctor of dentistry.
I am.
And you must know something about how insurance works with dentistry. And maybe you can let the folks know an overview of how does it work, or how does it maybe not work sometimes?
Great question. I have this conversation 2 or 3 times a day with a patient because it's such a big subject, and people, with the economy, it's
Oh, sure.
It's a question.
Sure.
How can I afford some dental work that you're suggesting, Dr. Bilski? So, dental insurance is there to help minimize the costs if they can with the benefit. So typically, if you're getting your teeth cleaned at least twice a year and you're healthy, not on medications, you should be okay. So you typically don't have increased dental bills.
Right.
But say as we age, we had a lot of dentistry done when we were in our teens. Now we're in our 50s, maybe going to our 60s. These teeth are cracking. Maybe you had a tooth that had to be removed because it abscessed. How does dental insurance help reduce the costs, or how does it impact you not so favorably?
Mm-hmm.
There are limitations and exclusions. Those are typically what are called PPOs, Preferred Provider Organizations, compared to the traditional dental indemnity insurance benefits. What that means is there are less restrictions, exclusions, and denials. So what am I saying? The PPOs are a lot tougher to have some things done because they might just say, sorry, Randy, that root canal, it's kind of far back. No one sees it. We're not going to authorize that.
Well, is PPO less expensive to purchase, though?
Not always.
Really?
Not always.
Okay.
So that is something that if you're working with a company or you own a company and you're purchasing insurance, that your employee has to pay for some of it. But that's the other problem. Employees sometimes don't realize that that's being deducted from their own pay.
Yeah.
So they think it's free, so they're going to take anything they get until they're kind of walk into the office and we tell them like, oh, geez, you got a lot of dental work here, a lot of cavities. I'm going to need to see you 2 or 3 times. Well, how much is that going to cost? And then we do what's called a treatment plan. And then sometimes the question is, can we authorize that through the insurance company, which is called a pre-authorization. And you see where I'm going, like a lot of steps, which creates a delay. And then by the time we get these answers back,
your teeth are rotting and falling out?
Somewhat, yes. Fortunately, it's not the case. And we never use that to leverage. But the point is, you really have to understand your plan. The good news is we have Danielle, Lindsay, Sophia, and Karen that are way on top of this stuff, more than I even care to want to know about it. And I really have to defer to those ladies when it is. And Danielle is our insurance savant, I call her.
That's good.
She knows, like she can even off the top of her head, just by knowing
that's really nice.
Who you work with, because we're an area local practice, what insurance company, and she can give you pretty much off the cuff, and of course verifies by going online, searches it. So in our practice anyway, we recognize that patients do want to use their insurance. We optimize the insurance, not make things up. We optimize. This is what your insurance does cover. This is what it excludes or denies or limits. This is your total out of pocket. Is this something that you'd like to move forward with?
It's best to know, and you can let people know.
Yeah, for sure.
Well, thanks for sharing that with us.
You're welcome.